everyone, I'm Dr. Parveen from Clinic Bangsar South. Our clinic is situated in Centrio Pantai Hill Park, Bangsar South area. This is a GP practice and an STD specialist clinic. So we see patients for all sorts of sexually transmitted diseases, screenings, treatment, vaccinations, as well as other GP general practice family clinic matters. One of the common and interesting topics that a lot of people ask us about is weight loss. We all are suffering from this problem, and all of us want a solution for this. Now, yes, of course, we all know input equals output. Everybody knows we need to cut down the intake, increase the exercise. These are things that we already know. Now, unfortunately, there are a lot of situations where people have tried multiple methods to lose weight, diet programs, and all sorts of things. Sometimes, and quite a lot of times, they don't work. So sometimes we need to have a little bit of help in order to bring this down and help people so that they can become fit, healthy, and avoid chronic illnesses in the future like diabetes, hypertension, dyslipidemia, high cholesterol, ischemic heart disease, stroke, other things. So it is important for everyone to get to a better weight. Now I'm just going to show you a little reenactment of what usually happens in the clinic. A lot of patients come to me with this kind of situations, and there's no stigma, there's no shame, everything is confidential. Please come to see me, even if you want to discuss how we can do this, and let me put you on the treatment plan and the follow-ups, and we go from there. So let's talk to the patient. Yes. Hi, Mr. Paul. How can I help you today?
Yeah, I'm worried because I am putting a lot of weight lately, being like a year, and that I haven't traveling, like do some work at the gym. I used to go to the gym usually, but I had an injury in my knee, and then I can't do it. Yeah, and so I wanted to know if you have anything else that can help me.
How much weight have you put on in the last 1 year?
Like 20 kg.
20 kgs. Okay, that's a lot in 1 year. Okay. Now we will calculate your BMI in a short while, but first let me explain to you. We do have some medications now which is doing very, very well and very effective. Okay. I don't know if you've heard. There's a big hype and there's a lot of talk about this medication called OZEMPIC. OZEMPIC is an injection that we can give weekly. It's a weekly injection, very, very safe. We give this for people to actually lose weight. And how does the medicine work? It's because the medicine will inhibit certain neurotransmitters in the brain, and this will trigger a feeling of satiety. You'll feel full, so you don't feel hungry, and that helps you cut down on the food intake. Now, with this medicine was actually invented for type 2 diabetic patients, right? It also brings down your HbA1c, your fasting sugar levels. But then they found that this medication also causes significant weight loss. So off-label, everywhere in the world now, we are using this medicine to help people lose weight. It's very effective. We have seen cases that people have lost weight from 20 to 40% of their body weight in about 6 months to 12 months, something like that. Of course, it varies for different people. Okay? Now, this medicine, what we do is we will give you a lower dose at the beginning, okay, 0.25 milligrams injection. You self-inject yourself. It's very easy, it's painless, it's very easy. I'll teach you how to do that. Do that for the first 4 weeks. After 4 weeks, you will get the second dose of the injection, which is 0.5 milligrams per week. Okay, and after that, on the 3rd month, it will go to the full dose, which is 1 milligram per week injection. So after the 3rd month onwards, then you can continue up to 6 months, 12 months, or 18 months, depending on how much weight you want to lose. Okay? And the only thing I would advise is when you come off the medication, then we will teach you and advise you how not to put the weight back on.
Yeah.
We don't want rebound weight gain. And this is all, we have a method to teach how to once you've created new habits, then you don't go back to the old habits where you're going to put on weight again. So this is how normally it goes. And then while you're doing this program, we will be monitoring your blood levels and checking you and seeing you to see whether there's any side effects and things like that.
Okay, and what about side effects?
Side effects. Now, the most common side effects would be nausea, vomiting, a bit of stomach upset. Those are the main side effects that are usually reported. Most people, after a few days, they get over these side effects and it's fine for them. But some people may not be able to tolerate because they have severe nausea, vomiting. So it differs from different people. So we'll put you on and we will observe and we will see how it goes. Okay? Now, if in case you prefer to take an oral method, we have the exact same medication. Semaglutide is the name of the medicine. Semaglutide, the same Novo Nordisk company, has now made the oral form. So the oral form of this medication is called RYBELSUS, and this one you just have to take 1 pill per day in the morning.
1 per day?
Yeah, 1 pill per day in the morning, and again we do the same thing, low dose, higher dose, and the highest dose. And we monitor you the same way. Side effects is exactly the same. Efficacy is exactly the same. So we do have this medication here. We have the injection form and the oral form.
I didn't know about it. It's new for me.
Yes, you can read up about this. We will give you the literature. Okay?
Thank you.
Thank you. So do come in to see me if you wish to discuss losing weight with RYBELSUS or OZEMPIC, and for us to monitor and take care of this whole process for you. Thank you.